And how's the pain in your legs right now?
Sheila Lawson is in her 90s. She's smart and fiercely independent and hates going to St. Paul's Hospital.
You get dumped at Comox Street, and that's a 5-minute walk when you're young and agile. But when you're old and decrepit, it's miles.
So St. Paul's is coming to Sheila. As part of the new way of care, her doctor is making a house call. Less efficient, but if it keeps Sheila out of the hospital, it's worth it.
Sheila will not do well if we have to admit her to the hospital. She doesn't want to be there. It's cheaper to have these things addressed here at your home rather than having you in the hospital where you'll end up getting sicker.
Managing senior care is becoming more of a problem at St. Paul's. Geriatrics is situated way up on the 9th floor, not the easiest place for the frail and elderly to get to.
Start weight shifting forwards.
But that's where once a week seniors who have fallen come to physio. The elderly make up 40% of all visits to St. Paul's Emergency. They get admitted more often, stay longer, and cost an estimated 3 times as much as a non-senior. The new St. Paul's will try to keep the elderly healthy and not feeling handicapped with community programs like these.
Not just being old, but being, well, can I use the word handicapped, Jane?
Feel free.
There you are.
I would agree.
Another plan for the new hospital, a dementia village similar to this one in the Netherlands.
And then as you inhale,
1 out of 11 Canadians over 65 suffers from dementia, costing our healthcare system $30 billion a year.
I think 15 years from now, the aging population will almost double. So I think there is that kind of looking forward. We need to plan ahead.
But the majority of St. Paul's patients don't live in Vancouver. Last year, 57% came from outside the city. Patients like Jillian Code, a heart transplant survivor from Victoria.
I've been coming here for 10 years. This is the only transplant center.
I started having shortness of breath.
Rowena and her daughter Asia travel from Nanaimo twice a year to see their specialist at the Center for Heart-Lung Innovation. St. Paul's is also a leader in COPD care, renal care, HIV/AIDS, and others. Many patients who rely on St. Paul's are happy it's moving.
I was so happy when you're in that one room for that period of time, and it's, you know, you're looking out over a parking lot full of garbage, you know, in a really old building, and yeah, it is kind of depressing.
It's still life-saving care in a crumbling setting. Imagine what a new St. Paul's can do. Randene Neill, Global News.